Good afternoon, ladies and gentlemen, and thank you for giving me the opportunity to talk to you today. My name is Andy Jones, and I'm going to explain to you how we feel that check X-ray post-hip hemiarthroplasty is no longer a necessity. Routine practice across the UK has been to get a check radiograph post-hip hemiarthroplasty or total hip replacement for fracture. However, back on the 24th of March, when lockdown 1 came in, routine went out the window, and we felt in Gloucestershire we needed a new normal. We therefore proposed to stop the routine check X-ray for intra-capsular fractures, and the reasoning behind this was we felt it would reduce movement around the hospital and therefore reduce the risk of transmission. And it would also reduce the strain on staff in the radiology department at a time when there were great pressures. To see if it was safe, we audited our last 3 years to assess the complication rate. Using the National Hip Fracture Database, we found that we treated 2,348 hip fractures in Gloucestershire. Of these, 1,230 were intra-capsular fractures. 41 cases were excluded as they had no check X-ray, leaving 1,189 in the analysis, 960 of which were hemiarthroplasties. Our primary outcome was dislocation or periprosthetic fracture noted on the check radiograph. And for this, the complication rate was 1.25% for hemiarthroplasties or 8.3% for hip replacements. And this can be seen in this graphic here. However, I'd like to draw your attention to the fact that there was only one case of dislocation on the routine check X-ray for hip hemiarthroplasties, giving actual complication rate pickup of 0.1%. The remaining 11 dislocations were all noted after a normal, satisfactory check X-ray. We spoke to the accounts department, who told us it cost roughly £30 per check X-ray, and so all these X-rays cost in the region of £37,000 for the trust, roughly £10,000 per year. So was it safe to change practice? Well, with a complication pickup rate of 0.1%, we felt it was, as the majority occur after a satisfactory X-ray. We've all seen X-rays like this in the trauma meeting. Fine, carry on. A not too dissimilar X-ray, albeit the other side. This patient went on to dislocate a few weeks later and was subsequently reduced. But their immediate check X-ray led to no change in their clinical path. There's also significant cost saving for the trust in the region of £10,000 per year, but we think this probably underestimates it as it doesn't take into account nursing and portering costs. And in this time of never-ending crisis, then reducing transmission between departments can only be a good thing. For hip replacements, our numbers were smaller and there was a higher complication rate, so we actually felt we should continue taking those check X-rays. The potential negative is obviously on training, as you don't actually get to see where you put that hip hemiarthroplasty, which is an important aspect of learning the operation. So our new normal in Gloucestershire, hemiarthroplasties, they don't get a routine check X-ray, hip replacements do. But if there are any intraoperative concerns or clinical concerns on the ward, then it's routine practice to get an X-ray. To ensure this was safe, we audited our practice back in May and June time, at which point we saw 78 intra-capsular fractures, the 10 hip replacements all got an X-ray. The 68 hemiarthroplasties, 59 didn't get an X-ray as per the protocol with no complications found. 9 did based on clinical needs such as pain or subsequent falls, but again, no complications were found, so we feel it is safe. We published this in the Transient Journal, and actually we noticed that other trusts and other support were doing it around the country, so we decided to try and garner national opinion. To do this, we sent a questionnaire via WhatsApp to the trauma leads across the country to assess their practice pre-COVID, during the first wave, and post-COVID or during the summer practice, and if they would change a support in practice as long as it was evidence-based. We got 85 responses, which we thought was reasonable, and unsurprisingly, 98% of trusts were doing check X-rays pre-COVID. This reduced significantly to 74% during the first wave, and didn't increase back to the pre-COVID levels, with current practice in the summer just 87% of trusts taking the check X-ray. Almost 70% would support a change in practice, and given this significant number, we've now contacted the NHFD to see if we can push through a central change in policy, as we believe that the new normal should be no routine check radiograph for hemiarthroplasty, but actually an X-ray based on clinical need only. I'd like to thank you for your attention and invite any questions.